Welcome to day one of the 90-day corporate health and or online health and performance program. We want to first start you out with being able to go through your online assessment. Now, be cautious and be clear and make sure you fill out this survey with the best information possible. Okay, because we want to make sure that we put you in the right program and we progress you appropriately. Let's take a minute and so we understand exactly how to fill out the survey, because I won't be meeting you personally, and so I'm going to need to assess you primarily through your data collection. So if you could open up your Excel file on your computer, and then let's go through the different categories and so you understand how to fill the information out completely. The survey begins with some cardiovascular assessment. Now, it's going to say a 5-minute staircase exercise. What you want to do is go up and down a 13-step flight of stairs as many times as possible in 5 minutes and record that number. Now, to count it, each flight of stairs traveling up and down would be 2. So down the stairs is 1, up the stairs is 2, down the stairs is 3, and so on until you get to 5 minutes, and simply put the total number of flights in the yellow boxes. Okay? The second group is also going to be your blood pressure and pulse. And so if you don't know that, you can go to a Walgreens or CVS or one of these corporate health screenings or different clinics, and they give free blood pressures just so we have some baseline findings. Okay? Moving on to the muscular endurance. We now want to do a wall sit and a plank. We call that a plank is like a push-up, except you're on your forearms and tiptoes as opposed to the hand. And so if you're unfamiliar with a plank, it is, you can Google it, but you want to get yourself into a push-up position, but resting on the tiptoes and forearms to brace yourself. The next one is called a wall sit, and this is a favorite PE exercise and or team training exercise, where an individual sits up against the wall, brackets themselves in a 90-degree fashion, and you want to have your head and shoulders against that wall and your butt sitting down 90 degrees, and you want to see if you can't last 2 minutes or so on the wall. Just have your cell phone out and record the time that you get until you rise up out of that 90-degree position. Moving on into some of the muscular endurance exercises now, into the strengthening. And so for these, you want to do a push-up, classic push-up. Make sure the chest touches the floor. Now you can put a cup or like a mug there on the floor to brace your chest. And you don't have to go all the way down, but if you have like a coffee cup or so, you can utilize that. For females, you want to modify this push-up by performing it on your knees as opposed to the tiptoes. That's the variation. However, you do continually go down and touch your chest to that coffee mug. Make sure you only count the push-ups if you actually touch. That's important. Okay, next, you want to perform a sit-up. Now, if you can't do a sit-up, that's fine. You just leave it blank and just use the plank score. But if you can do a sit-up, you want to make sure your feet are anchored either with a partner, a friend or a spouse or a sibling, and or you can use a couch. Tuck your toes underneath the couch, use that to brace yourself, and do as many as you can in the time allotted, which is a minute. The next one is for the lower body, is where you want to sit in a chair and stand up. So you can use either a table, like a coffee table, to stand up and down, or you can use a firm chair about the height of a dinner table chair, or like a living room chair. But you want to make sure that that chair is stable, and because you're going to be moving up and down with pretty good velocity, and so you don't want to have a chair that can, like a stool. You don't want to use a stool, something that's a little more sturdy than that. Then the last one is called a bench dip. Now, dips are kind of like a push-up. Make sure you Google this, but it's when you have the hands back behind you and you press up and down. For the females, once you Google the bench dip, there is a modification. The legs are not going to be straight or elevated. They're going to be bent 90 degrees to make it slightly easier. For the males, your feet are going to be extended, but they're going to be on the ground. You're not going to do dips with the feet elevated. Okay, so when you Google the dip exercise, you make sure that you make that modification for the females, and for the guys, the feet are going to be on the ground. In the appearance category, it's going to ask you for your weight, your height, so make sure you fill that out accurately, and a few circumference measures. Now those measures are going to be around the neck. So for guys, you can use your collar, but I would like you to use a some kind of measuring tape. You can go to the tailoring store, you can go to like a sewing store, because they have these inexpensive, $1 or $2, because I want to make sure we can track the change. And so measure on the neck, right here below the Adam's apple for a guy, or right here at the collarbone for females. Make sure you take your hair out of the motion, go right around the neck. To do the shoulder measure, you want to stand at attention like you're in a military stance, feet together, knees together, and you want to go right around the collarbone area. Okay? For the waist, you want to have the shirt up, and you want to go right around the navel, and make sure that the tape stays even. It's not off center or diagonal. So do it in the mirror, and or have your spouse, friend, or a sibling be able to measure you to get very good consistent measures. The last measure is the hips. The hips are the largest part of the buttocks, okay? So when the feet are together, knees are together, you're standing tall, and you take that tape around the largest part, of the buttocks area. Okay? Next, then, you have a couple of survey things to kind of see how your lifestyle is. You know, your average sleep per day, the average meals per day, if you consistently meditate or pray, and then if you use tobacco or drink alcohol, make sure you indicate to kind of let us understand what kind of stressors you may be facing in your lifestyle choices. The last particular category are going to be divided into, again, the other half of your lifestyle, your nutrition, and just, again, a leaf, a salad, greens, spinach, these kinds of things. Protein sources. Remember, an egg is equivalent to 2 ounces, and so you want to fill out how many ounces you eat per day. You know, a chicken breast is about 3, a good sized hamburger is about 3. So you want to fill that out as accurately as possible. Include the liquids that are water or tea. Those all count as water. As long as it's not sweetened tea, like green tea, black tea, but not like sweet tea. You can't count that as water. Okay? And then once you fill out your dietary survey items, you then, if you do have your blood laboratory values, if you've gotten a physical in the last 6 months, put those values in. Okay, if not, just leave them blank, because they won't be as accurate, and so we can't use those. That's okay. The better the information, the more accurate the survey will be, and we could type you. But if you don't have some of the information, okay, leave it blank, and we will categorize you to the best of our ability with the information that we have. So that's totally okay. Again, though, I would like more information. More information is better, and so if you do happen to get a physical or there's a corporate health screening, just email me so I can update the records appropriately and get you the best classification. There's no point in having you into the program if we're not challenging you appropriately, we're not progressing you appropriately, and so the value for our recommendations and the stress level that we're placing your body into won't be the most beneficial for yourself. Okay? And then the last category is, again, some of the health history. We want to kind of see your family and or inherited risk factors that we might have to modulate when we put together your long-term health strategy. If there's cancer in your family, if your siblings have cancer, diabetes, Alzheimer's, if you have some of these risk factors, just indicate that with a yes/no answer. Again, filling out the questions in the yellow box, and then we'll get the information back to you with a focus for the 90 days and a program that can progress you appropriately. Thank you very much, and we look forward to partnering with you on your improved health and performance goals.